Hello, my name is Dr. William Hart, and for over 40 years, I've dedicated my life to one mission: helping older adults not just live longer, but live stronger. As a senior myself, now 68 and thriving, I know firsthand how the little choices we make each day can add up to either vitality or vulnerability. You see, I wasn't always this sharp. A few years ago, I found myself waking up with stiff joints, a foggy mind, and, believe it or not, recurring leg cramps that would shoot down like lightning in the middle of the night. I was doing everything right: exercising, drinking plenty of water, even eating lots of fruit, or so I thought. But here's the shocking part. It turned out some of the fruits I was eating every single day were silently working against my health. So let me ask you something. Could the fruits in your kitchen be secretly sabotaging your energy, your joints, and even your circulation? You might be surprised to learn that popular fruits like bananas, grapes, and even watermelon, while considered healthy for the general population, can actually trigger hidden health problems in people over 60. But here's the good news. Today, I'm not just going to tell you what fruits to avoid. I'm going to reveal the exact fruits that can support your heart, ease your digestion, and even help you move with more strength and confidence as you age. By the end of this video, you'll walk away with a clear, science-backed guide to choosing fruits that work with your body, not against it. So grab a cup of tea, sit back, and stick with me, because what I'm about to share could change the way you eat forever. Now, let's start with one fruit that surprised even me: pineapple. Most people see pineapple as a refreshing, tropical treat packed with vitamin C, and it's true, pineapple does offer some benefits, especially due to an enzyme it contains called bromelain. At low doses, bromelain can help with digestion and even reduce inflammation. But here's the catch, and it's one I learned the hard way. In higher amounts, bromelain can actually do the opposite. When you eat too much fresh pineapple, especially on an empty stomach, it can begin to irritate the soft tissues in your digestive tract. Even worse, for those of us over 60 who may already struggle with joint pain, arthritis, or even gout, pineapple's acidity and enzyme content can make symptoms worse, not better. I remember one patient of mine, Susan, 72, who loved starting her day with a pineapple smoothie. But after weeks of doing so, she noticed increased stiffness in her knees and burning in her stomach. We ran some tests and ruled out major issues. The culprit? Too much fresh pineapple irritating her gut and sensitizing her joints. Pineapple contains oxalic acid, which can contribute to calcium buildup in joints. And too much bromelain can overstimulate the immune response, leading to inflammation instead of reducing it. That's why I always tell my patients, if you have arthritis, gout, or sensitive digestion, limit pineapple intake, especially when your stomach is empty. Stick to no more than 1/2 cup per serving, and avoid canned varieties soaked in syrup. Better alternatives? Try papaya, which has gentler enzymes, or ripe kiwi, which supports digestion without irritating the stomach lining. Remember, even healthy fruits can turn into hidden hazards, especially after 60, if we don't listen to how our bodies respond. Now, let's talk about something many of us love: bananas. They're easy to eat, portable, and packed with potassium. But here's the catch: bananas have a high sugar content. For most of us over 60, consuming too many bananas can quickly spike your blood sugar levels, especially if you're already dealing with diabetes or prediabetes. The sugar in bananas is rapidly absorbed, causing a quick rise in blood glucose, and this can lead to fat storage around your belly. Or worse, visceral fat, which is linked to heart disease and other chronic conditions. So, if you're someone who struggles with maintaining healthy blood sugar levels, or you're concerned about your waistline, you might want to rethink reaching for that banana every day. But here's the good news. You don't have to cut out bananas entirely. Just limit your intake. A small half banana is plenty for most people, and enjoy the potassium benefits without causing a sugar surge. But what about raisins? Now, I know raisins might seem like a healthy snack, dried fruit. Right? Well, raisins are even worse than bananas in terms of sugar content. When grapes are dried, their natural sugars become highly concentrated. This means you're consuming more sugar in a smaller serving, which can spike your blood sugar even faster than fresh fruit. For seniors with a history of diabetes or blood sugar issues, this is a major concern. So, here's the question. Are raisins worth it? Or should you avoid them altogether? I'll tell you this. If you're craving a sweet treat, stick to fresh grapes, and always eat them with the skin on. This will help slow the absorption of sugars and provide extra fiber. And remember, portion control is key. Limit raisins to half a cup per serving. Here's my promise to you. By making these small adjustments to your diet, avoiding excess sugar from foods like bananas and raisins, you'll feel more energetic. Avoid that afternoon slump, and keep your blood sugar levels in check. Stick with me, and I'll show you more tricks to help you live stronger, longer, and healthier. Just keep watching. Now, let's move on to grapes, another popular fruit that's often considered a healthy snack. But, just like bananas and raisins, grapes come with a high sugar content. The natural sugars in grapes are easily absorbed by your body, which can lead to a sharp rise in blood glucose levels. For those of us over 60, this is especially concerning because high blood sugar can cause fat to accumulate around your organs, particularly your visceral fat, the dangerous fat that wraps around your internal organs, like your liver and heart. This is linked to increased risks of cardiovascular disease and even type 2 diabetes. Now, here's where it gets even more concerning. Raisins. Raisins are simply dried grapes, which means their sugars are concentrated into a much smaller, more sugar-dense serving. A handful of raisins might have the same amount of sugar as a full bunch of fresh grapes. And that concentrated sugar hits your bloodstream all at once, causing those dangerous spikes in blood sugar. For those with a history of diabetes or insulin resistance, this is something to be mindful of. Raisins could easily push your levels beyond the healthy range. So, what's the best way to enjoy grapes if you're trying to manage your health? Eat fresh grapes, but limit your portions. Stick to half a cup or less per serving. And always eat them with the skin on. The skin provides fiber, which can help slow the absorption of sugar and regulate your blood glucose. Here's my promise to you. By understanding the effects of sugar from fruits like grapes and raisins, and making smart, mindful choices, you can protect your health, keep your blood sugar in check, and enjoy the sweet taste of fruit without all the negative side effects. Stick with me. And I'll keep guiding you on how to make the best choices for your health and vitality in your golden years. Now, let's talk about another popular summer fruit, watermelon. Watermelon is refreshing, sweet, and hydrating, but for older adults, there are some important considerations. Watermelon is packed with water, which sounds great, right? However, when you consume too much, it can lead to electrolyte imbalances. This happens because the high water content can dilute the levels of essential minerals in your body, such as potassium and sodium, which are crucial for maintaining healthy circulation and nerve function. In addition, watermelon contains an amino acid called citrulline, which has been shown to help with blood circulation. While that sounds like a benefit, for some people, too much citrulline can actually cause a drop in blood pressure. This can be problematic for those with already low blood pressure or those who are on medications that affect blood pressure regulation. But here's where it gets tricky for many seniors. Eating too much watermelon can lead to frequent nighttime trips to the bathroom. Excessive water intake before bed can cause you to wake up multiple times during the night to urinate, which can severely impact your sleep quality. And as we know, poor sleep can lead to a host of other health problems, from decreased immune function to increased risk of heart disease and cognitive decline. So, what's the solution? Moderation is key. You can enjoy a small portion of watermelon as part of your diet, but don't overdo it, especially close to bedtime. Stick to a reasonable serving, like half a cup, to avoid disrupting your sleep and keeping your electrolytes in balance. Here's my promise to you. By being mindful of how much watermelon you consume and when you eat it, you'll protect your hydration levels, maintain healthy circulation, and enjoy a better night's sleep without those frustrating nighttime bathroom runs. Stick with me, and we'll continue to uncover more insights to help you live your healthiest life. Now, let's talk about something many of us enjoy on a bright morning: oranges. Oranges are a fantastic source of vitamin C and antioxidants, which help boost immunity and improve skin health. However, for older adults, there are a few things you need to keep in mind when consuming this tangy fruit. First off, oranges are naturally acidic, which means they can have an impact on your digestive system and even your teeth. The high acid content can irritate the stomach lining, especially if you're drinking orange juice on an empty stomach. This can trigger acid reflux or heartburn, leading to that uncomfortable burning sensation in your chest. If you've ever experienced that feeling, you know it's no fun. Additionally, if you overconsume oranges or orange juice, it can be especially hard on those who suffer from gastritis or acid reflux. People with stomach ulcers or gastroesophageal reflux disease, GERD, should be particularly cautious. The high acidity of oranges can exacerbate these conditions, leading to increased pain and discomfort. And don't forget about your teeth. The acid in oranges and orange juice can erode tooth enamel over time. So, if you're someone who loves sipping on a glass of fresh orange juice throughout the day, it's important to rinse your mouth with water afterward to help neutralize the acid and protect your enamel. Here's my advice for you. If you love oranges, you don't have to give them up entirely. Moderation is key. Enjoy a small portion of orange or a splash of fresh squeezed juice. But don't overdo it, especially if you have any stomach issues. You'll still get the health benefits without causing any discomfort or long-term damage to your digestive system or teeth. Remember, health is about balance, and with a little knowledge, you can enjoy your favorite fruits without worry. Now, let's talk about another tropical favorite, mangoes. While they are undeniably delicious and packed with vitamins and antioxidants, mangoes come with some considerations, especially for older adults. First, mangoes are naturally high in sugar. They contain a significant amount of fructose, which can raise blood sugar levels quickly. This is important to keep in mind, particularly if you have a history of diabetes or are watching your blood sugar. Mangoes have a high glycemic index, GI, which means they can spike blood sugar levels more than other fruits. If you're diabetic, it's best to limit your intake of ripe mangoes, as they are high in sugar and can affect your insulin levels. Additionally, mangoes are considered a heating fruit in traditional medicine. This means that they can have a warming effect on your body, which may not be ideal for everyone, particularly for those with liver issues or digestive problems. If your body is prone to overheating, mangoes can lead to indigestion, bloating, or even acid reflux. Now, what about green mangoes? While unripe mangoes may seem like a healthy option, they come with their own set of challenges. Green mangoes are more acidic, and when eaten with spicy seasonings or salt, they can irritate the stomach lining and cause discomfort or even gastritis. The tangy, sour taste may be a treat for some, but it can be harsh on the stomach, especially if you're sensitive. So, what's the solution? Moderation is key when it comes to mangoes. If you enjoy mangoes, opt for small portions of ripe fruit, and avoid pairing them with spicy or salty condiments. If you have diabetes or any digestive issues, it's wise to consult with your doctor before indulging in too many mangoes. By keeping these tips in mind, you can still enjoy the sweet, tropical flavor of mangoes while maintaining a balanced and healthy diet. Now, let's turn our attention to another popular fruit often found in many households, the green apple. Green apples are known for their tart flavor and crispy texture, but they can pose some challenges, especially for older adults. One of the main concerns with green apples is their high fiber content. While fiber is an essential part of a healthy diet, the insoluble fiber found in green apples can sometimes cause digestive discomfort. For many people, particularly those with sensitive stomachs or digestive issues, eating green apples can lead to bloating, gas, or even stomach cramps. If you're not used to consuming large amounts of fiber, green apples might be a bit too much for your stomach to handle. Additionally, the high acidity of green apples can be problematic. If you have sensitive teeth, you might find it difficult to chew them without discomfort, especially if your dental health isn't at its best. The tartness can also be harsh on your teeth enamel, leading to potential wear over time. This acidity can also increase stomach acid and cause issues for people who have acid reflux or gastritis, particularly if you eat them on an empty stomach. For some, eating a green apple on an empty stomach can trigger a burning sensation or discomfort due to the increase in stomach acid. So, what's the solution for enjoying green apples without the downsides? If you love their refreshing taste, try pairing green apples with a small amount of protein or healthy fats to help buffer the acidity and reduce the likelihood of digestive discomfort. And if you have sensitive teeth, Cut the apple into smaller pieces to make it easier on your mouth. Moderation is key here as well. If you're sensitive to fiber or acidity, opt for smaller portions of green apples or consider switching to a milder variety of apple. As always, listen to your body and adjust accordingly to ensure that you can enjoy this healthy snack without any discomfort. As we reflect on the information shared today, Dr. William Hart's insights remind us that health choices, especially when it comes to food, should be made with careful consideration. The fruits we consume, while often packed with nutrients, can have varying effects on our bodies, especially as we age. Whether it's the high sugar content of bananas or the digestive challenges of green apples, it's clear that moderation and awareness are key. The important takeaway here is that older adults need to listen to their bodies and make choices that align with their specific health needs. Fruits like mangoes, watermelon, and green apples, though healthy in moderation, can have unwanted effects when consumed in excess, particularly for those managing diabetes or digestive issues. By staying mindful of what we eat and how it impacts our body, we can make informed decisions that enhance our health and well-being. It's also crucial to consider food pairing and timing to avoid discomfort, ensuring a balanced and satisfying diet. Now, I encourage you to reflect on your own experiences with food choices. Have you noticed certain fruits that affect you differently as you've gotten older? What strategies do you use to make healthier food choices? Share your thoughts with us. And let's continue this conversation to support one another on this journey to better health. If you found this video helpful, please don't forget to like and subscribe to Senior Moments Matt for more health tips and advice. And, as always, feel free to share your own experiences or ask any questions you may have in the comment section below. Your insights might just help someone else on their path to healthier living.